Welcome to the Explainer. Today we are talking about something almost all of us have to deal with, headaches. They can be anything from just a little annoyance to something that completely knocks you out for the whole day. So, what if the real key to getting a handle on them is just knowing that they aren't all the same? In this Explainer, we're going to dig into that idea. We'll break down the three most common types for adults, figure out how to tell them apart, and see what the science says about actually getting some relief. Okay, let's dive in. First up, what's really going on in your head? Beyond just pain, there are actual medical diagnoses. And the two most common are what doctors call primary headache disorders. That just means the headache is the problem. It's not a symptom of something else. And those two are tension-type headache and migraine. And boy, are they different. A tension headache, well, that's usually felt on both sides of your head. It's often described as this dull, constant pressure, almost like a band is squeezing your skull. A migraine, though, that's a whole different beast. It's typically a throbbing, pulsing pain, usually just on one side of your head, and it gets so much worse if you try to do anything, even just walking around. Now, migraines get a lot of attention because of how awful they can be, but just look at this number. Tension-type headaches are way, way more common. I mean, up to 78% of people will have one at some point. They are, by a long shot, the most common headache out there. And that brings us to a really crucial third type. This one isn't a primary headache. It's a secondary one. And honestly, it's a trap that so many people fall into without even knowing it. It's called medication overuse headache, or MOH. And yeah, it's when the thing you're taking to get relief actually starts causing the pain. It's a really vicious cycle. You get a headache, you take a pill, and it helps. But if you start relying on that pill too much, your body gets used to it, and it can actually make you more sensitive to pain, which leads to, you guessed it, more headaches. That's why these limits are so important. For simple stuff like acetaminophen or ibuprofen, that too much line is about 15 days a month. But for stronger, migraine-specific drugs like triptans, the limit is even tighter, fewer than 10 days a month. Okay, so we know the main types, but let's get practical. How do you know if your headache is just, a standard issue tension headache, or if it's something you need to get checked out right away? Well, doctors have a checklist of red flags they use to spot signs of a more serious problem. This includes things like having a fever at the same time, or any new symptom like weakness or confusion, or maybe the pattern of your headache suddenly changes. But the big one here, the one to really pay attention to, is onset. If a headache hits you out of nowhere, full force, like a clap of thunder, that's a medical emergency. You need to get help immediately. Now for the non-emergency stuff. If you're just wondering if those bad headaches you keep getting are actually migraines, this is a super helpful little tool. Just ask yourself these three questions. In the last few months, have your headaches made you feel sick to your stomach? Did light really bother you? And did they stop you from working or studying for at least a day? If you answer yes to two or more of those, there's a really good chance you're dealing with migraines. It's a great way to start a conversation with your doctor. So let's talk about the toolkit. What can you actually do to manage these headaches? Let's start with strategies that don't even involve medication. Right. Your first line of defense isn't always in a pill bottle. Keeping a headache diary, for instance, is such a powerful tool. It's like being a detective, trying to find your personal triggers. Simple things, too, like rest, an ice pack, and regular exercise can make a huge difference. And please don't underestimate the power of stress. Therapies that help you manage it can be incredibly effective. Okay, but when you do need that immediate relief, these are your go-to options. For tension headaches and milder migraines, things like acetaminophen or ibuprofen are usually effective. For the more severe migraine pain, that's where triptans come in. But look at that warning column again. See? It always comes back to that risk of medication overuse headache. So the lesson is, use them when you need them, but use them wisely. But what if your life is just constantly being disrupted by headaches? What happens when just treating attack after attack isn't cutting it anymore? Well, that's when you have to level up and talk about prevention. So what's the tipping point? We have these pills that treat the pain right now, but at what point should your whole strategy shift from being reactive, just putting out fires as they pop up,
to being proactive and trying to stop them before they even start. The guidelines are actually pretty straightforward. If your headaches are seriously messing with your life, if you're having 4 or more headache days a month, or if you're getting dangerously close to that medication overuse zone, it is absolutely time to think about preventative therapy. And listen, the goal here isn't to get to 0 headaches, though that would be nice. It's to cut them down by half or more. And that right there can be a total game changer.
And the really good news is that the prevention toolkit is getting bigger and better all the time. There are lots of options, from traditional daily pills, some you might even recognize as treatments for things like high blood pressure or depression, to newer injectable therapies that are designed specifically to target the migraine process. Finding what's right for you is a journey, and it's one you should definitely take with your doctor. And that leads us to what might be the single most important point. While there may not be some magic cure for a headache disorder like migraine, there is 100% hope. As the experts themselves say, always offer hope. Most primary headaches can be controlled. It's all about finding the right combination of strategies that works for you. Control is possible.
So maybe think of it this way. Your headache is telling you a story. It's trying to communicate something. And by listening, by paying attention to its patterns, understanding its type, and finding its triggers, you stop being a victim of the pain and you become an active manager of your own health. And that is the first, most powerful step toward writing a new, much less painful story.